What is a Pap smear? A Pap smear, also known as a Pap test, is a procedure used to test for cervical cancer in women. This screening procedure involves the collection of a sample of cells from a woman's cervix. The collected sample of cells are then smeared or spread onto a microscope slide so they can be sent to a lab for careful microscopic examination. Detecting cervical cancer early with a Pap smear gives you a greater chance at a cure. A Pap test can also detect changes in your cervical cells that suggest cancer may develop in the future. Detecting these abnormal cells early with a Pap smear is your first step in halting the possible development of cervical cancer. Why are Pap tests done? A Pap smear, along with a pelvic examination, is an important part of a woman's routine health care because it may detect abnormalities that can lead to cancer. Most cancers of the cervix can be detected early, especially if women have Pap smears routinely. As with many types of cancer, cancer of the cervix is more likely to be successfully treated if it is detected early. A Pap test is not only useful for detecting and diagnosing cancerous cells, but it can also screen for other cervical and vaginal abnormalities. Cervical cancer screening should begin at the age of 21 for all women, including those who are not sexually active. How is a Pap test done? A Pap test is an in-office procedure that only takes a few minutes. You will be asked to undress either completely or from the waist down and put on a hospital gown. You will then lie down on the examination table with your knees bent and your feet resting in stirrups. Your doctor will then gently insert an instrument called a speculum into your vagina. A speculum spreads the walls of the vagina so the doctor can easily see your cervix. This may cause a sensation of pressure in your pelvic area. A cotton swab is sometimes used to clear away mucus that might interfere with the sample. Cells are gently removed from the cervical tissues and from the back of the vagina by using a soft brush or a flat scraping device called a spatula. The doctor will then transfer the removed cells collected and put them onto a glass slide. This slide is then sent to a laboratory where they will closely examine under a microscope for any abnormalities. Typically, a doctor will then perform a full pelvic examination upon the completion of a Pap smear. Women may experience some light spotting or mild cramping for just a few hours following the Pap smear. When can I expect the results? The results of a Pap smear are usually available within 2 to 3 weeks. If you have not been informed of your results after 3 weeks, please call our office. What are the risks? There are actually no known medical risks associated with Pap smears. However, there are certain factors or conditions that may interfere with a Pap test. An infection or blood may hide abnormal cells, and douching or vaginal jellies, creams, or medications may wash away or dilute the cells. To help prevent this, you should avoid douching, sexual intercourse, and using vaginal medications or hygiene products for 2 to 3 days before your test. You and your doctor at Professional Gynecological Services can decide when it's time for you to begin Pap smear testing and how often you should have it done based on your individual risk factors.